So today we're gonna study another important management which is related to the chest pain. Let's start. Bismillahirrahmanirrahim. So basically we have actually two causes of the chest pain. One is angina, the other is MI. What is angina? Angina basically the only symptom that the patient mostly represent. It is actually retrosternal pain. Okay, in the position. The patient, how will you manage it is basically you have to stop all the dental treatment and you will give the patient the anti-anginal drug which is 0.4 milligram glyceryl trinitrate sublingually, or either you give a spray of 4 milligram for rapid relief. You will give the administration of the oxygen, check the pulse and blood pressure. If there is no relief within 3 minutes, then there should be a second dose of the glyceryl trinitrate. Okay, then basically monitor the vital signs. If basically the patient does not if the discomfort continues even after 3 minutes, then give a third dose and monitor again the signs and symptoms and call someone medical assistance. If the discomfort is relieved after patient for medical evaluation before further dental means before the start of the procedure, you should further evaluate the patient and basically refer the patient to the physician. If this discomfort still continues after 3 minutes, then even after a third dose, then assume this is myocardial infarction means. So what is myocardial infarction? It is the common cause of death and should be recognized as the patient's fate depends on the first few minutes. What are the signs? The patient has a severe crushing retrosternal pain. Okay, basically then pain radiates to the left shoulder, okay, down to the arm, okay, then but very occasionally as felt only in left jaw also, shoulder, arm and jaw. Okay, basically then weak irregular pulse, shallow breathing. The patient has nausea, vomiting, shock and loss of consciousness patient suffer from. The management of this patient is that place the patient in a comfortable position that basically allows easy breathing, means in a comfortable position first of all. Then do not flat if there is a left ventricular failure or pulmonary edema. Do not lie the patient flat because there are chances of ventricular failure and pulmonary edema. Call someone medical assistance, call to the hospital for the medical care, then give 50/50 nitrous oxide and oxygen from the general anesthetic or relative analgesics. Give nitrous oxide or oxygen, okay, and then you can give also analgesics machine to relieve the pain and anxiety. Basically constantly reassure the patient and give oxygen if necessary. Then give aspirin, which is actually 352 milligram orally as soon as urgent measures have been carried out. Okay, then give also IV line with the drip of crystallite solution which is 30 ml per hour. So you have give aspirin, then you also give the crystallite solution. If severe discomfort, then also titrate the morphine. Okay, morphine sulfide which is 2 milligram subcutaneously or IV for every 3 minutes until the relief is obtained. Monitor loss of consciousness, then follow the protocol for the cardiopulmonary resuscitation. Okay, so you have to stop all the treatment. Okay, place the patient in a comfortable position. Do not lay because there are chances of edema also and failure of the ventricular. There are also the chances of the failure of the left ventricular. Okay, then you can give nitrous oxide, then you can also give the analgesic machine. You can reassure the patient, give the oxygen, then give aspirin number first which is actually 352 milligram crystallite solution. You can give morphine, you can give actually, and still patient is loss of consciousness, then you will give the CPR.